Hi, I'm Dr. Jonathon Geller. I'm a board-certified optometrist at Illinois Specialists in Murrieta, California. And I provide comprehensive care, family care, senior care, pediatric care, really, which is all the family care. And about half of my career is spent with refractive surgery patients where we simply correct people's vision with LASIK, PRK, implantable lenses, and a comprehensive range of services. Illinois Specialists is a very trustworthy group, and that's part of what makes us a great selection for eye care. I think the absolute greatest quality we have at Illinois is the humanity of the doctors and the staff, especially the staff. Our doctors have been here 20 and more years. Our doctors are university affiliated. Most of us trained in Southern California. A few people from Ohio and Virginia and Maryland and places like that, but most of us in Southern California. We all live locally, so we have expertise. We keep the expertise right here in the valley where we all live. We are available to our patients really round the clock. We have emergency services, and sometimes when patients are looking to select a surgical provider, the fact that we are all local and available makes a big difference to them, and that can be the deciding factor. But our doctors are technically excellent, but it's really special that I enjoy working with everybody because they are great people first, and that's what it takes to be a great doctor. The reason it's important to have an annual eye exam is that the eyes really are the window to the soul. Especially with today's imaging, which is one of the biggest features of eye care today. We can now image the back of the eye, the center of the eye, and the front of the eye, and it gives us an immediate link to neurological diseases and vascular diseases, so the brain and the heart become key parts of an eye exam. And glaucoma, one of the leading eye diseases, is called the thief of sight because it's completely asymptomatic. Patients don't know they have a problem until they wake up with a dramatic vision loss one day, and their glaucoma has actually been lurking there typically for years undetected. So we can detect very early eye diseases, and that allows our treatments to be so much more effective than late discoveries. So we really like to get in there early and able to manage eye diseases so much better with an early start. What you should expect during your annual eye exam is to be greeted with a huge smile at the front desk. Then you should be greeted with a huge smile by our technicians who start off your exam. And then when you meet your eye doctor, you should expect a huge smile, a sincere getting to know one another, and then the most thorough eye examination possible with the best technology possible. And we're proud of having all that at Illinois. The diagnostic testing that's done during an annual eye exam includes glaucoma testing, cataract testing, a full visual analysis, and state-of-the-art imaging with Optos scanning lasers. The Optos is our favorite piece of technology for comprehensive eye exams because it gives us a great view of the optic nerve, the retina, helps us detect retinal diseases, and we can literally see things that are difficult to see through any other means. So the advances in imaging in eye care have been the greatest advancement of all in the last 20 years. We have a lot of options to improve our patients' lifestyles. My viewpoint is that it focuses mainly around freedom. Patients tend to come here initially when they're younger because they are dealing with some blur, and we're able to free them from their blur, sometimes with something as simple as a pair of glasses. Patients will then wear those glasses, and then they're getting tired of glasses, so we're able to bring freedom back to them with contact lenses, and now they're free from their glasses. They enjoy that freedom a lot because contact lenses give some nice freedoms, but then often years later, after putting a lens on their eye every day and dealing with some innocent but daily complications, whether it be dryness or irritability from a contact lens, patients then start to look for freedom from their contact lenses, and that's when the subject of refractive surgery and LASIK comes up, because that's the ultimate freedom and the ultimate impact on their lifestyle, is to let people just wake up in the morning with their vision automatically on, automatically clear. Their morning routine is no longer blurry. They no longer have to hesitate when somebody says, let's go to the beach, the swimming pool, the water park. Their eyes are just ready to go. They don't have to have that little conversation in the back of their head like, oh, what about my contacts? Where am I going to put my glasses at the beach? So when it comes to lifestyle and optometry and ophthalmology, it's all about freedom, whether it just be the simple glasses, the simple contact lens, or the ultimate freedom of just having their vision corrected.